a case of hepatomegaly. A 48-year-old Hindu male patient Basappa, a farmer staying at Gokak, comes with complaints of loss of appetite and weakness since 1 month and a lump in right hypochondrium noted 10 days back. The patient was apparently alright 1 month back when he lost his appetite and had a feeling of weakness. No history of vomiting or regurgitation. There is history of loss of weight of 5 kilos in last 1 month. What are the causes of rapid loss of weight? Tuberculosis, malignancies, acquired immune deficiency syndrome, insulin-dependent diabetes mellitus, thyrotoxicosis, and anorexia nervosa. There is no history of cough, expectoration, hemoptysis, chest pain or breathlessness, no history of frequency of urine and increased thirst, no history of fever or jaundice. The patient has noted fullness and lump in the right hypochondrium 10 days back. What can be the causes of lump in right hypochondrium? Hepatomegaly, gallbladder lumps, right renal lump, and lumps arising from the colon and pyloric region of the stomach. Also, there could be soft tissue swellings arising in the abdominal wall as anywhere else. Regarding history suggestive of liver lumps, there is no history of fever, chills and rigors, no history of blood and mucus dysentery, no history of jaundice, that is high colored urine or icterus, no history of breathlessness, palpitations or leg edema. The patient is a chronic alcoholic since 20 years. No history of hematemesis, melena or distension of abdomen. No history of bleeding tendencies, bone pains, swellings in the axilla, neck or groin. No history of taking hepatotoxic drugs like anti-tuberculosis drugs. Regarding history suggestive of other lumps, no history of colicky pains in the right hypochondrium. No history of hunger pains or pain related to meals. No history of vomiting or hematemesis. No history of urinary symptoms. No history of altered bowel habits, abdominal distension or constipation. Regarding history suggestive of liver cell failure, there is no history of jaundice, tremors, loss of axillary hair or loss of libido, no history of drowsiness or altered consciousness, no history of hematemesis, bleeding per rectum or ascites. What is the earliest manifestation of liver cell failure? Sir, jaundice. Jaundice is the first sign to appear in case of liver cell failure. Past history, there is no past history of jaundice, hospitalization or blood transfusion. There is no family history of liver disease in the family. Which liver diseases are familial? Hemochromatosis, hemosiderosis, Wilson's disease, Gaucher's disease and glycogen storage diseases. And in children, Gilbert's disease, Dubin-Johnson syndrome, Crigler-Najjar syndrome and Rota syndrome. Proceed. Regarding personal history, the patient is an occasional smoker and a chronic alcoholic. Whom do you call a chronic alcoholic? Chronic alcoholic is defined as one who has been consuming at least 80 grams of alcohol per day for more than 10 years. Which diseases are common in alcoholics? Liver diseases like hepatitis, fatty liver, cirrhosis and hepatoma, pancreatitis, gastritis and peptic ulcer, malnutrition and dilatory cardiomyopathy. Proceed. Bowel and bladder habits are normal, sleep is normal. On general examination, the patient is moderately built and poorly nourished. Nails show pallor, no cyanosis or clubbing. Is clubbing seen in liver diseases? Sir, in biliary cirrhosis and with secondaries in the liver, clubbing may be seen. Conjunctiva and tongue show pallor and glossitis. Sclera shows no icterus. There is angular stomatitis, no xerosis or Bitot spots. Which vitamin deficiency causes angular stomatitis? Vitamins B2 and B6, that is riboflavin and pyridoxine. And glossitis, vitamin B2, B6 and B12. Is it because of cirrhosis? No sir, it is because of nutritional deficiency. Cirrhosis or chronic liver failure will cause deficiency of fat-soluble vitamins, that is vitamin A and D. Why? Due to deficiency of the carrier proteins which are essential for the transport of these fat-soluble vitamins. Proceed. There is no edema of feet, JVP is not raised, there is no significant lymphadenopathy. Where do you see hepatomegaly with lymphadenopathy? Firstly, lymphomas and leukemias. Secondly, infections like miliary tuberculosis and infectious mononucleosis. Thirdly, storage disorders and infiltrative disorders like amyloidosis and sarcoidosis. Proceed. Vital signs are normal. Looking for signs of liver cell failure, there is no jaundice, palmar erythema, spider nevi or gynecomastia, no loss of axillary hair, no loss of testicular sensations, There is no deputrance contracture or parotid swelling, no flapping tremors or altered consciousness. On examination of the abdomen, on inspection, there is no distension of abdomen or fullness of the flanks and renal angles. There is slight fullness in the right hypochondrium, which moves with respiration. Abdominal movements are normal, no abnormal pulsations or peristalsis. Umbilicus is normal, no dilated veins, scars or sinuses. Hernial orifices and spine are normal.